So I'm going to talk a little bit more about Chagas disease. Our researchers that are here also will give a lot more background on the clinical side of Chagas disease, but I've been asked to talk about the Chagas disease in the United States. We know that this disease is present in Latin America, but is also present here in the United States. And part of my work over the last almost decade has been supported by the CDC. And I have a grant with them. It's called a cooperative agreement with Dr. Sue Montgomery, who's been my mentor. She works at the CDC in the parasitic disease branch. She may be on Zoom. By the way, shout out to the Zoom people. We're grateful to have you here as well from across the world. But we have a cooperative agreement to raise awareness, mostly with healthcare providers, on Chagas disease in the United States. And the reason for that is because patients are not being diagnosed, we're not screening, and when we do screen them, a lot of providers don't know how to treat the disease as well. And so our goal has been targeted at healthcare providers, but we do it through a lot of different ways, through the health departments, through public health professionals, through veterinarians, all kinds of different ways of getting the message out to the healthcare providers ultimately that Chagas is in the United States and it does exist. We have treatments, we have specialists that can support this, and I'm going to talk a little bit more about those efforts. So we haven't, some of you, I'm just going to call in the room, anybody here not really know what Chagas disease is? There may be a few, a couple of people, okay. Every presentation will have a little bit more information about Chagas disease, but the basic is that it is transmitted by the kissing bug or triatomine vector. Some people also call it a reduvid bug. We have them in the United States. We have them in all of Latin America. There's 100, maybe 100 or more different species. We have 11 different species here in the United States, and they're all capable of transmitting the disease. Not every triatomine bug, I'm going to call them kissing bugs just to try to keep it across the board. That's what we call them in the United States. Not every kissing bug carries the parasite that causes Chagas disease. And we don't really know how many of them do carry the parasite, the T. cruzi parasite that was mentioned by Danielle earlier. But T. cruzi is capable of being in the gut of this bug, and it is transmitted through the feces. It takes a blood meal while people are sleeping. It's not a pretty transmission process. It takes a blood meal, the belly swells, they defecate, the parasite lives in the feces, it gets rubbed into the bite site, eyes, nose, mouth, any other place. And as long as that parasite gets into the bloodstream, it's capable of transmitting Chagas disease. And so it's not effective transmission, but it does happen. And the triatomines that we have here in the United States are capable of passing the disease on to people. And so we talk a lot about people who have encountered the disease in other countries of Latin America where it is more prevalent, but I also want to talk about how we have it here in the United States, not only from people that have it, that have come from other places, but also that have caught it here and are probably undiagnosed as well. I just wanted to also mention, it is not a new disease. It is not coming from Latin America. It has always been in the Americas, including the southern half of the United States. We found it in mummies, 9,000-year-old mummies. There's also a rumor, I don't know how true it is, that Charles Darwin may have passed from Chagas disease, encountered in his travels. And so this is something that has been present in the United States since forever. And I just wanted to be clear about that. And I have a map showing where we have the 28 now states where we have found the triatomines that are capable of passing on the parasite. For a contextual piece from a public health sort of awareness, Chagas disease accounts for at least $627 million in global healthcare related costs annually. And this is probably a gross underestimate because there's a lot of people that are undiagnosed and not receiving treatment. So it is a huge problem. It is a big disease. As Danielle mentioned, maybe we're not going to call it tropical, but it is neglected. It is under-resourced, underfunded, under-researched, and under-known. A lot of people do not know about this disease. I've already mentioned the transmission by the bug itself, but it's also important to mention that it can be passed from mother to fetus. And this is really important because we think that could be the #1 way it's being transmitted into the United States or for people living in the United States. Babies are being born with Chagas disease coming from people who may have moved here from other places. And this is one of the reasons why in our public health world right now, we have a huge push for screening of pregnant women. And this is what Dr. Novotny had mentioned about sort of this upstream approach, not waiting till people are in their 50s or 60s and presenting with heart problems to diagnose them, but catching the moms when they're pregnant and screening them. We screen pregnant moms for lots and lots of things. Chagas is not one of them. And this is where it's a little tricky, because does everybody need to be screened for Chagas disease? No. But do you live in an area where there's a lot of transmission potentially happening? Quite possibly. Have you lived in Latin America? Was your mother from Latin America? Yeah, we should consider screening. Having just moved from Texas, well, from San Diego to Texas and back to San Diego, I spent the last many years in South Texas doing research on Chagas disease. It is everywhere there, the parasites and the bugs. And so were we screening moms? No. And this is where we run into things of thinking about where do we set up these screening programs and who should be screened. Also, other transmission is by blood transfusion. It is blood-borne pathogen, so you can get it from organ transplantation. And then also oral transmission does happen. This is a picture of the insects. Whenever I give presentations to physicians at meetings and things like that, one of the biggest questions I get is, what does the bug look like? Especially for our physicians here in the United States. We have 11 different species here. They don't all look the same. And I would say here, being in Southern California, I'm still learning the new species here. I'm very familiar with the Texas species. I'm not as familiar with the ones here in California, but all of these exist in the United States in some form or fashion. And I'll talk a little bit more about some of the work we're doing to do increased surveillance to find these bugs, because this is where the public health initiative starts. In order to convince the physicians to do more screening, we have to prove that the bugs are here. We also have to prove that the infection exists here and that there's a reason to be screened. And so this is all part of that bigger picture I was talking about getting to the actual screening protocols at the primary care level. So human prevalence of Chagas disease in the United States, you're going to see a lot of numbers today because we don't know. We just don't know. In epidemiology, tracking diseases is difficult. If you don't pick up the rock and look underneath, you'll never know what's there. And so I feel like with Chagas disease, we're just now starting to lift this veil of how do we screen and where are we looking and how do we do this? And we'll talk more throughout the day about some of the different things that have come into play, like now we have access to drugs, we have better screening, we have better diagnostics. A long ways to go, but we're working on it. Someone from the press contacted me yesterday and said, I'm looking for the numbers of how many Chagas disease cases we have in San Diego County. And my response to them was, that's a really great question. I wish I knew. It's not reportable here. Sorry, shout out to the county. We're working on this. It is reportable in LA County, and Dr. Maymandi will talk a little bit more about this as well. But in California, Chagas disease is not a reportable condition. So it's really hard to track how many cases there are. LA County is doing a great job right now, at least I think they are, with making it a reportable disease, but it's complicated to make a disease reportable in the United States. Coming from Texas, where it's a reportable condition, and shout out to anybody from Texas that's on the Zoom right now, they've done a really good job with every case that gets detected through blood donation or by a doctor. It gets followed up with by an epidemiologist. So they try at least to confirm it with the CDC and try to support that person with seeking out treatment. So back to how many cases of Chagas disease do we have in the United States? I want to pull up a recent paper by Dr. Irish and Whitman and several other colleagues, Dr. Byrne. These are estimates. These are modeled estimates because we don't know the prevalence. And so I just want to reiterate, these are modeled estimates of people that were born in Latin America living in the United States. This does not include local transmission. So we estimate somewhere close to 300,000 people based off of prevalence numbers that are a bit sketchy coming from other countries, but we're doing our best. We think that about 57,000 people are living with heart disease caused from Chagas. They may be diagnosed or undiagnosed, most of them undiagnosed. And that maybe 108 annual births from infected women, we estimate about 43 to 44,000 women are living in the United States that are infected with Chagas disease, and of them, about 108 will pass it on to their babies when they're born. So these are gross underestimates. I just want to put that out there. Does not include local transmission, but it's a start. And we're doing what we can with the numbers that we have. Thanks to Dr. Maymandi, I pulled this from your website last night. I hope you don't mind. I did credit you here at the bottom. This is where we're here in California right now, and I think it's really important to talk about this. It's estimated that 70 to 100,000 people with Chagas disease are living with the disease here in California. We don't really know. 45,000 people potentially infected in Los Angeles alone. There is some numbers out there that you can also find that talk about how many cases we expect to find if we're actually screening for them, but it's pretty significant. So I believe that California is the top state, and please correct me if I'm wrong, but I think it's the top state in the nation with the highest estimated number of people who have Chagas disease, followed by Texas, and then also as the cities go, Los Angeles, I believe, is top. Is that correct? Okay, I'm still figuring, I know my Texas stuff, but I'm learning my California stuff now as well. So this is significant for California, and the fact that it's not reportable is also significant as well because it's very underdiagnosed. This is a map from the same paper by Dr. Irish. She put this together showing Southern California areas, showing estimated numbers of adults with Chagas disease. And if you can look here, Imperial County is actually the highest. And we have a public health presence from our School of Public Health here at San Diego State in Imperial Valley, and I hope we can increase screening there as well. We suspect we have quite a few cases there. And this is just a little bit more data that I found from another paper from 2021 that talks about the prevalence of the infection amongst the bugs. So the kissing bugs are infected, but we don't really know how many. And so this was a study that was done as a systematic review showing the percentages of infected bugs that they found. And I'm going to talk a little bit more about some of the research we're doing with collecting bugs here in San Diego and across the US-Mexico border. We are also finding infected triatamines as well with the military bases. I throw this in there because these are the exact numbers that have been published in Texas on their website. And the reason why I bring this up is because they started making a reportable disease in Texas in 2013. It was reportable for humans and animals. They got so overwhelmed with the submissions of dogs testing positive for Chagas disease that they stopped making it reportable because they couldn't handle the load of all of the cases being reported, and it was officially called endemic in dogs in Texas. So it is not endemic yet in humans. That means that transmission is happening more than imported transmission. Local transmission is happening more than imported transmission would give it the title of endemic. But for dogs in Texas, it is called endemic. But for human cases, you can see that the case is increasing, and I hope it's because there's more surveillance being done. But to bring up this important fact that 18% so far up to 2020 of these cases were considered to be local transmission. So for a long time, it was thought that we didn't have local transmission, but it turns out we do. And these are a few of the cases. And of these, we found 3 acute cases. And for our Brazilian colleagues, they're like, we get acute, Chagas cases all the time. It's pretty miraculous for us to have a healthcare provider figure out that a patient has acute Chagas disease because they have to know about the transmission, they have to know about the patient, they have to know about the disease. So the fact that we have 3 in the United States, we're pretty excited about it. In our Chagas world, it's complicated to diagnose an acute case here. We had 153 chronic indeterminate, which means 153 people have it and have no symptoms, but they found it most likely through a blood donation. And then we had 47 cases of these cases that were suffering from symptoms and probably untreatable at that point. The most common way that people find out about having Chagas disease is what Mayra talked about with herself: donate blood. First-time blood donors are tested. After that, you're not tested for Chagas again after that after you've donated for first time. So what is, Mayra, you had this experience, you have this letter, what do you do? As an advocacy group, we're working on putting information in those letters to make it less vague. Here's some numbers to call. Here's some websites to go to. I personally get Facebook messages from people. I got this letter. What do I do? Who do I talk to? U.S. Chagas Disease Network, who some of the members may be on the Zoom right now. We like to connect each other and have a website where we can connect patients and providers together, but they're few and far between. And we're going to talk a little bit more about collaborations because we have some incredible physician experts on this topic, a couple of them here in the room, who are also ready and willing and able to train other providers on how to treat and handle these diseases as well through these networks of collaborations. I'm going to touch really quickly on animal prevalence in the United States because dogs are sort of the sentinel, right? If our dogs, our sweet little puppies, I don't know how many of you have dogs at home, but you know, if your dog tests positive for Chagas disease, that means you're living somewhere where there's transmission happening very close to you. Doesn't mean that you have it. Dogs sleep on the ground, they eat the bugs. The bugs really like them when they're sleeping. So it doesn't mean that you have Chagas disease, but it does mean that you're living very near it. And so we're sort of looking at how dogs can be reservoirs in the United States and those sentinel species. And like I said, in Texas, it's endemic in dogs. Lots of people have dogs that are testing positive for Chagas disease, and these dogs are dogs that live in their houses, sleep in their beds. And so we know that there's potential contact happening. It was first found in dogs in the US in 1972. We don't fully understand the role of domestic dogs in this transmission cycle, but we're working on it. There's different seroprevalence reports, but up to 57% of some populations of dogs have tested positive for Chagas disease. I wanted to quickly just tell you the whole reason I even got into Chagas disease was Dr. Leo Cropper at the US Air Force in San Antonio, Texas, told us at the School of Public Health there that their military working dogs, which is at Joint Base San Antonio, which is where they train every military working dog for the entire US military, they had 10% of their dogs dropping dead from Chagas disease. And when they looked a little further, they were finding triatamines in the barracks where the men and women were sleeping as well. And when they looked a little deeper, they tested those the triatamines or kissing bugs for Chagas disease for the parasite, and of them, 60% tested positive. And of those 60% that tested positive, 60% of those bugs had human blood in their gut. This is how it all kind of started, was the dogs. So I always come back to the dogs. Dogs are dying of Chagas disease at this military base. Do we have a problem? And since then, they've implemented a lot of procedures to help protect the servicemen and women. They have bed nets now. They treat their uniforms. They even have bed nets that are treated around the dog kennels because the dogs are still dying from Chagas disease at this base in San Antonio. So as I promised, here's the map of all the states where we do have active triatamine activity in the United States. I believe that Nebraska was the newest one that was added. For those of you that are not familiar, it's right here in the middle of the United States. They have found infected triatamines in Nebraska now as well. So I think that we'll have a conversation about climate change soon. And it might be mentioned too, this as climate changes, there's more exposure potential with hotter seasons. These bugs like hot weather, and they're more active during hot weather. So the hotter and longer these hot seasons last, the more potential for transmission to happen. This is just a little bit more about the triatamines. Again, up to 50 to 60% of triatamines being collected may test positive for the parasite. And so I think this is really important, and I'm not going to go into too much detail, but I do think it's important to mention for future presentations that will coming today that there's different genotypes of the parasite itself. And we most commonly find in Central America, Mexico, and the United States types 1 and 4. And I mention that is because a lot of the treatments and diagnostics and different things that have been looked at for this particular parasite have been conducted in Latin America, deep South America, Argentina, and Brazil, and places where they have a lot of research history. And it's in those places where they've developed the diagnostics that work really well with the genotypes that are there. They don't necessarily work as well with the ones that we find here. And this is important because our diagnostics are kind of a hot mess here in the United States. It's really difficult. You have to have 2 tests that show that you're positive. It has to be confirmed by the CDC. And I think that we're slowly starting to change that a little bit, but it's important to mention that there's these differences that exist that make some of these challenges a little bit more difficult. So keeping us on time, because I know we're over, what I'd like to do is just quickly talk about a little bit more about some of the activities. I mentioned the CDC initiative we have for raising awareness with physicians. We also do echo sessions, which is that telementoring where Dr. Mandy, I think, and Colin and several other Maida, we just had an echo session for World Chagas Day week. We're going to call it World Chagas Week on Tuesday, where we like to get providers CME credit to join in to hear presentations about Chagas disease. And then we have some research projects going on. I have some collaborators here in the room as well with the Navy and with Dr. Oren. On our team, Dr. Quintana's on Zoom, where we're actually working with the military to look for triatamines in the field along the US-Mexico border military installations, test them, and then we're also going to be testing blood samples that comes from the biorepository of men and women that were stationed there, collecting all the dog data, because dogs are now actually being screened annually for Chagas disease if they're in the military. And then we're also working on a policy paper to recommend to all the branches of the government, of the military, what to do when somebody tests positive, including what to do with the dogs. Dogs are considered to be service members as well. And so we're recommending treatment protocols, recommending what to do. We're working with several infectious disease doctors. And then on top of that, our final recommendation is going to be screen every person coming into the military for Chagas disease. That's a big one. I'm putting it out there. And if anybody's listening in the world, that's what we would love to have happen. If you're coming in to the military in the United States, get screened. When you're going out, get screened, get tested. And we'll see how that works. But that's going to be our policy recommendation. And then lastly, I wanted to show you this model that we use that I was mentioning, the target, healthcare providers in the center, everyone else, we're working on providing that information to get to those healthcare providers. And very special support from the public health groups, the agencies, the state health departments, the local health departments. They do a huge share of the work of collecting data and thinking about this disease, and we'll continue to do that. And lastly, mentioning a newborn screening pilot project that we were given support from to do this work to screen 30,000 newborns, their dried blood spots, which actually is testing moms because it's the antibodies of the mothers. And it should be the largest prevalence study done in the United States. And it's all going to be done from different counties in Texas. And hopefully that'll give us a better idea of what the southern state prevalence looks like, at least among the population of women of childbearing age. And then I believe that we're going to have lots of discussion about the barriers. I know Colin and Sheba are going to talk about the low provider awareness, the absence of screening programs. And so I'm just going to skip right into this last part about taking this as a One Health approach. I think many of you probably have heard of One Health, but it's this where we link the animal health, the human health, and the environmental health all together. So we have our entomologists, amazing work doing surveillance on these insects. We have the veterinarians that are sometimes even more educated than our healthcare providers, human healthcare providers, on this disease. And then we have our human healthcare providers that we want to link into this through the One Health initiatives. And I think this is my message overall is this is the push for us to get our stuff together and start talking across the platforms about how we can bring more awareness to this disease. And I want to thank all my partners because there's so many of them, and thank all of you for being here.